I am going to welcome our speaker today. With us here at the AANMC, we have Dr. Sean Hesler, who received his medical training from the Southwest College of Naturopathic Medicine in Tempe, Arizona. He's the recipient of the 2018 American Association of Naturopathic Physicians President's Award and the 2011 SCNM Alumni Award for Community Service for his commitment to global and community health throughout his career. Alongside his wife, Dr. Sarah Preston Hesler, he co-founded Mama Baby Haiti Birth Center in 2010. Dr. Sean currently serves as Executive Director for Naturopaths Without Borders, a not-for-profit organization operating in Haiti, Mexico, Thailand, and Phoenix. In addition to sharing lessons on global health at universities and conferences around the U.S., Dr. Sean teaches medical students and professionals in seminars and at Naturopaths Without Borders sites. He's also adjunct faculty at A.T. Still University and really uses the tools of root cause to stimulate healing and life shifts in his patients. Dr. Hesler specializes in cognitive enhancement, genomic medicine, biohacking, mental emotional conditions, and pain through physical and mental emotional therapies. So I am super psyched to have you with us today. Dr. Sean, I'm going to turn it over to you. I'm going to make my face go away, but I'll be here for questions. We'll take questions and answers in about a half an hour or so for those of you on the call. Thanks so much, and thanks for joining us.
Thank you so much for having me. I'm really excited. So as that wonderful intro said, I'm the Executive Director of Naturopaths Without Borders. I also have taught at SCNM. I teach outside of SCNM. I kind of have a traveling roadshow of nutrition and pain classes with some other doctors that I'm really happy to team up with. So I just got back from weekend teaching at Bastyr University, California, those students. But my focus really for my whole career is global health, and it's what I most love talking about. So let me tell you a little bit about my story. I went to the University of Hawaii at Manoa for my undergraduate degree. I was dead set on becoming a chiropractor. I was a chiropractic patient in high school after a sports injury that I sustained to my back. My PA actually referred me to a chiropractor when I wasn't getting better after 2 weeks to get me back on the field. And my family was very skeptical, but they're like, well, we really trust our PA. He's been amazing. And so I started seeing a chiropractor, and I've always had this very analytic brain. I want to know how things work. I don't want to know why they work. And so I started shadowing with a chiropractor and learning the different variety of techniques, even beyond what he did. He could speak to the whole field of chiropractic. And from then I did a high school project, and I was really excited to interview him and ask him all these questions. And my last question was, what do you think about the other systems of holistic medicine? Like, do you think the acupuncture works, these other things? Because I didn't grow up with any of that. I grew up in a conventional household. And he said, yeah, he's like, I think it all works. I don't do it. I focus on what I do, but, go out and explore. And so I did. So I met Dr. Ryan Furchoff, who was an SCNM 2002 grad when I went to college, and kind of the rest is history. So one of the things that shifted me from wanting to be a chiropractor who also got an acupuncture license, who also got additional nutrition training and a homeopathy degree, was that the ND really puts all these things together. And so the parallel to this is what I wanted to do as a career, as a focus, which patients I wanted to see. I knew that I did not want to only do private practice, and not to mean chiropractors, but in my mind at the time, I didn't want to crack backs all day, 5-10 minutes a piece. And so aside from this, I had also started developing an interest in global health and understanding my position of privilege within the world and the layers upon which that existed. And so I started looking into doing service work, and then eventually I read a book called Mountains Beyond Mountains, which has spurred so many careers in global health and community health. It's about it's basically a biography of Dr. Paul Farmer and his organization Partners in Health, and they do amazing work all over the world, and it was fascinating to read his story. I've read several of his books as well, which are much heavier and academic. And that was kind of what tilted me toward, I want to be a complete physician. I need to be able to prescribe. I need to be able to do all of these therapies together and to practice sustainable medicine. And so the ND was the clear choice. So my first global health experience was in between graduating undergrad and before SCNM. It was with Mar de Jade, which is kind of an eco resort where the jungle meets the sea in Chacala, Mexico, which is about an hour and a half north of Puerto Vallarta. And that funds, at the time, funded a sliding scale clinic in town for people who couldn't afford medical care. I was with a very holistic MD who had learned acupuncture before she went to MD school, was learning homeopathy, and she's one of my inspirations in life. And so I had the bug, and I've really run with it. So one of the reasons why I chose SCNM was because it had, at that time, the only chapter of Naturopaths Without Borders, which fascinated me because they were doing local work. They were looking to do more international work. It's this, fledgling student group run by some really amazing people. I think I had read on SCNM's website, like an interview with the co-founder, Tamara Torres, who is still an awesome part of my career, and I'm better for knowing her. And so I started doing NWB from my first quarter. Actually, 13 years ago, this month was my first Rocky Point trip, and actually the first Rocky Point trip in Mexico of Naturopaths Without Borders. So this is actually a picture from that first trip. It was then a Sinclair gas station. That dinosaur is still there, but the gas station has changed ownership. And so I went as much as I could. I coordinated some local activities as well. And then along with our team, this is absolutely not just me. There's so many others, hundreds of volunteers a year. We have a whole board of directors that have pushed this organization forward to be what it can be. I did come back to SCNM as director of community health for about a year and a half in 2015. So I was kind of facilitating the community clinics, facilitating, getting students some additional training outside of the community clinics, helping to start the Roosevelt Health Center for SCNM, as well as starting a community health selective that has kind of rolled into a community health and group visit class outside of SCNM. So enough about me. Let's talk a little bit about global health.
Dr. Hesler, before you start, we have a quick poll that we wanted to do for our folks to see who's in attendance right now.
Excellent.
So if you can just fill out your poll, and then we can see who is joining us. And Dr. Hesler, feel free to keep going.
Sure. Let me see if I can. I think I'm sharing my screen, so I don't want to.
Yeah, you are.
There we go. Okay. So essentially what we mean by global health is not licensure. It's not necessarily for-profit practice. It's not necessarily not-for-profit practice, but essentially service work for communities around the world who are underserved. So the approaches to this really vary by organization, by individual, and what we have found is that, and really this is kind of the best practice now, is that the best work in global health is driven by the community for the community. And this contrasts with what we commonly see from some groups, especially, again, don't want to paint with a very broad brush. It's not all religious groups, but there's a tendency to have what we call a savior complex for volunteers who mean well, but they're kind of coming down thinking that they know more than the community. Maybe they do in some areas, maybe have areas of expertise. We have expertise in naturopathic medicine, for instance, but you really need to start by listening. You really need to have a deep sense of humility in everything that you do, and understand that you, as a person with an American or a Canadian passport, can go almost anywhere in the world and kind of, in a sense, for better or worse, exert influence. And there's so much more to a culture, to a society that you don't see, that's running underneath, that you can, with your privilege, with your power, exert change for good, change for bad, or a mix of the two. And it's not just what you think of it, it's how it actually plays out. And so some of that humility, having work driven by the community, doing what's asked, going where you're asked, focusing on capacity building, focusing on support, is to minimize negative downstream effects, maximize sustainable downstream effects as well. So, how does naturopathic medicine fit with that? So when I guest lecture at Bastyr or other classes in naturopathic philosophy, one thing that I poll my audience about is who are you? Who is it that you want to be serving? What do you want your practice to look like? What is it that you want to do on a daily basis for the rest of your life? And that, I think, can help steer you in your journey to decide what kind of healer you want to be, what kind of person you want to be, and then work on how can you sustain that lifestyle. So one thing I poll these students on is, what is your definition of naturopathic medicine? And so, you know, early on in your program, you're getting bits of philosophy, you're learning about different modalities, you know, about holism and things like that. But really, my definition up here, for what it is, not for my sales pitch, my elevator speech, is naturopathic medicine is the ultimate synergy of healing traditions from around the world with modern medicine and science. And I say this because what we have learned as a profession is a synthesis of systems that have existed for hundreds, if not thousands of years from around the world. It is a multicultural system of medicine that has been put together by our elders. And as such, to me, it belongs to the world as well. I don't think it should just stay in the United States and Canada in the form that it's in. The reality is that there are NDs and various versions of naturopathic with different levels of training all around the world as well. And so, you know, recently with the work of the World Naturopathic Federation, my eyes have been opened to really how far it has spread and how these practitioners are working around the world within indigenous healing cultures, within modern cultures. So what we do is utilize and teach each of these modalities, and we do our best to also teach our students and our volunteers, our volunteer NDs, you know, the history of these tools and how best they work within the communities where we're working and within the set of volunteers that we have, and in training our own community health workers as well. So pictured is our trip from our recent trip to Thailand, which I just came back from a couple of weeks ago. I'm still like recovering sleep-wise. Flipped time zones as I get older are not compatible with my body. And then also, this is actually one of my favorite pictures that I use whenever I can. In the bottom right is a picture of Andres, who is our head community health worker in Haiti. So in Haiti, we are community health worker focused. We have 4 lay people who we have trained to to have some basic medical skills, and mostly to be able to educate patients, groups of patients on their own, in their own group visits, their own group medical visits, on various topics. So they could have a GERD talk. GERD is, gosh, just ballpark 1 in 3 adults that we see in our clinics have reflux, acid reflux. So many patients have hypertension. About half of our adult patients have chronic pain that we are addressing in the clinics. And so rather than us do just these one-on-one visits, we would rather have the community healing itself. And so we hire with a good wage 4 community health workers, give them the skills to go out and help in their community, to the extent that they're able to, and then to continue their training and foster their development. So this is capacity building. And so this is actually Andres teaching some CCNM students from last year about local plants. He knows a lot about local plants. So I wanted to give kind of a quick case study here. This is a this set of symptoms is kind of typical, and I wanted to kind of highlight how what we do very uncommonly involves medications. I will say that there are some people with some very severe conditions that are very far on the disease spectrum, and to get them safe and on the way back to health, sometimes medications are warranted. And we're in an area where follow-up can be very difficult, but we're always also using our foundational naturopathic therapies as well. But there's a time and place for medications, and we do run into that in our travels abroad. So I had a 34-year-old Haitian patient. This was maybe 5-6 years ago. She had shoulder pain worse with abduction, so coming up to the side. And really, she had trouble raising her arm even up to 20-30 degrees. She also had some low back pain radiating down her leg, which is actually the medical definition of sciatica. I go on rants with my volunteers and students. I go on rants in my pain class about the appropriateness of that term sciatica. It's so often other causes. I had no access to imaging, and so so my question to students is, what do you do next? And they all say physical exam. We need to get in there and touch our patients. Touch itself is healing. Patients around the world are used to their providers who I empathize with. They are strapped for time. They're strapped for resources. And oftentimes they don't have the training in orthopedics that we do as NDs to properly diagnose and treat patients. And oftentimes, even if they had this diagnosis or that diagnosis, piriformis syndrome or herniated disc, they might not have the tools, and their patients might not be able to actually afford the care. They might not have access to the care that they need. So to them, if it doesn't change their treatment plan, why further investigate? And to us as NDs, it really matters what the treatment is, because we are so good with physical medicine. At SCNM, we're trained in in the Canadian schools, we're trained in acupuncture. And so the diagnosis really does matter, even if we're just using our hands. So anyway, no imaging, did some PE. Basically, she had supraspinatus damage. She had a tear, some impingement syndrome with that. And so, okay, why did that happen? Was it traumatic? Did you have an injury? No, it just kind of came on insidiously, and it was just getting worse and worse. Okay, what do you do for a living? What do you do on a daily basis? Typical kind of Haitian work. How do you sleep? So she goes like this. She sleeps on her arm sideways like this. And this is exactly how to cause impingement syndrome. So on the one hand, what I can do in that visit is work on that area, see if I can use some cross fiber friction, use some active release technique to actually try to get some release there, to free up some space, get that muscle healing, but also, right, treat the cause, totally cause them. So, can we find a different sleeping position for you? Can we be strategic with pillows, et cetera? And so that really made a huge difference. It was very tender muscle work that I was doing with her. The low back pain radiating down her leg was not sciatica. It was, not due to a disc herniation. There was piriformis syndrome. It wasn't radiating all the way down the leg. Like, it was actually irritating the piriformis muscles, probably irritating what we call the posterior femoral cutaneous nerve. And so she was having hamstring pain and some low back pain that also was due to really tight muscles. She would bend over and wash clothes with her wrists, and that gives people very tight back extensors, lumbar extensors, the rector spinae. But also her piriformis was so tight. So I worked that out. Radiating pain was gone immediately. Gave her a stretch for that. So I treated her with my hands and with education. I did not need to use NSAIDs, which in this case, she was taking as needed. They would help temporarily, but they're also kind of eroding your stomach lining, causing inflammation in the gut. and preventing healing of the tissues themselves. So better to avoid opioids, avoid NSAIDs. Again, judicious use of medications when really needed. And so I'll oftentimes tell patients, you know, if you have a really bad headache and you can't get in to see us right away, you know, there's no harm. There's no sense in suffering. So take, you know, 2 ibuprofen, call me in the morning kind of thing. But if we can get to them ahead of time, we can educate them on using herbs like Passiflora, on using castor oil massage on their own, even better, right? So the more education we can do, the more we can prevent these things from happening and needing medications. So what I really love about naturopathic medicine, this is not an exhaustive list. These are just the things that I had to pick to fit on a slide. There's so many things I love about our medicine. The breadth of tools is one of them. So I'm with the chorus of NDs that says, let's not be defined by our modalities. When you're doing your elevator speech and you're telling people what you do and why, you know, why people should choose naturopathic medicine, don't just say, oh, you know, don't just list our modalities. That said, as a global health ND, having the breadth of tools that I have where I can use physical medicine, like for that case. For a case of hypertension, I have herbs, I have dietary change, I can work on stress relief, I can do acupuncture. For GI cases, the same set of tools, right? If I don't have something available, we're in Haiti, we don't have access to supplements, I don't have those probiotics that I would use, I can mix it up. I can use abdominal massage. I'll always have some tool for my patients, no matter what's going on with them. I also think, so we just finished Naturopathic Medicine Week last week. So this is a really good timing for this talk. And I did a Facebook Live with the Integrative Healers Action Network, which is an excellent organization in California focused on disaster relief. And so we had this talk about there's a really good bridge that NDs build between public health and one-on-one clinical consults, one-on-one medicine, stress relief, trauma response, whatever it is. We really speak both languages well. And the work that we do is preventative, which is the crux of public health, you know, identifying community, population level causes and mitigating them. We do that on the individual level. And so I encourage my colleagues as well to take a step back and look at our 6 principles at a community level, treating the causes of illness, preventing, treating the whole society and not just the people who come in to see you. How can you really spread that knowledge? How can you get your patients empowered to educate others as well? And so what you will always have as an ND is you'll always have food to deal with. You can do elimination challenge diets. You can you know, initiate weight loss diets. You can initiate diets to reduce inflammation, to reduce your food sensitivities, to fill in micronutrient and macronutrient gaps. We treat a lot of malnutrition in Haiti. So you always have that. You always have the plants. Maybe you don't, you know, in Arizona, we have desert plants and some of the other plants we have to bring in, but using local plants as much as possible, you'll always be able to educate your patients on using plants that are growing around them or on cultivating their own to take care of their health. You can, you know, grow basil in your house, and there's a good carminative to help you with gas, for instance. And you'll always have your hands. So the case I gave you was purely a hands and educational patient. And those things, even if I have no tools, I drop in the middle of the jungle, I can start working, I can still start helping people no matter what. I don't need medications. I don't need anything else to start. Not that those things aren't great. I love to have supplements. I teach using micronutrients as medicine, etc. But I'm always going to have stripped away from all those fancy things. I always have my hands. So a couple travel tips I wanted to throw in here just for fun. I just started publishing on my Dr. Sean X Instagram and Facebook as I've been traveling the last few times. I've realized as volunteers come to work with us, they're they're looking at my gear, they're looking at how I pack, and they're curious because I do it quite a bit. And I definitely have some deficiencies. I'm really bad at packing, and luckily I work as a team with Dr. Sarah, my wife, to to efficiently pack. I just, for some reason, can't wrap my head around doing it really efficiently, and she's awesome at it. So anyway, I started sharing through Instagram stories and posts, like some of my little travel hacks, which oftentimes are gadgets. You can't see right now, but I have, you know, a couple of mics. I'm streaming on a camera. That's a really good travel camera. I bring 2 lenses with me. I bring a light and a mic for the camera, you know, so I'm set to run all of the photos and videos for NWB as I go. The lighter I pack, the more room I have for supplies. The more room that I have for maybe donations or, you know, upgrading my camera gear so I can get some new shots to tell our story and tell our patient stories in a new way. I do recommend bringing probiotics and enzymes. So traveler's diarrhea is real, and it's not just due to microbes. It's not just due to unclean food, unclean water, or you more often than not in Haiti, because we have our kitchen dialed in, you not having good hand hygiene in the clinic and picking something up from a patient. It's also, you're just eating different foods when you travel. And so your macros change, your micros change, more starch, maybe less fiber. Constipation is a thing with travel. It's part psychological, part this diet change. And in some people, they're eating just, you know, higher amounts of fat than they're used to. And so as your gut is rapidly trying to adapt to this, you can get some GI upset. So enzymes can help with that. Probiotics can help both with your defenses and help break down your foods. I have a whole soapbox on the specificity of probiotic strains and all that, but most of the quality off-the-shelf probiotics are going to help prevent illness. Global entry is great for if you are, I'm speaking to Americans here, but there's also a very
Amen.
underutilized. Sorry?
Amen.
Amen. If you don't have it, or you don't have the $100 or whatever, it actually came with my credit cards. There's another little, if you can get one of those travel cards that gives you perks, awesome. CBP mobile passport is underutilized. So I actually recently, I don't want to say lost, but misplaced my global entry card. I was coming back from India, and I was like, oh geez, I don't know if I'm going to make this connection. So CBP mobile passport has, it's an app on your phone. You basically input all the stuff that you write on the form. You take a photo of yourself. It uploads to the officer. They've already seen it. They pull your thing up. You walk right through. I've so far not had a line with it, and it's totally free. So anyway, the little travel hack I wanted to hand along. Offline Google Translate and maps whatever languages you're going to need. Google Translate can now speak between you and the person you're talking to. Download offline to save data. Ditto for maps. And I have this little credit card size monkey tool, multi-tool thing that I believe it's TSA approved. So far, nobody's given me any grief about it, but you never know when you need to dig something out, or a screwdriver or bottle opener or whatever. So anyway, I just wanted to kind of throw those things at you, help you with your travels wherever you go in the world. So looking forward, NWB's future, so it's funny, I wrote these slides before NWB went through its 2 strategic planning sessions. We just 2 weeks ago finished that. And so we're still synthesizing a final report and everything, but we made 1, 3, 5-year goals and action plans, our awesome board members. And so we are looking at expanding the work that we do here in Phoenix. We currently support Peacework Medical, which is an underserved clinic primarily for LGBTQ, more appropriately known as gender and sexual minority patients. And it's been actually more difficult to recruit ongoing volunteers for work in Phoenix than it has been to go abroad, which is an interesting thing to reflect on. But we'd like to expand that, and we have also just established a relationship with an organization called Arogya Seva by our good friend Dr. Daya, whose sister-in-law is an ND who just graduated from SCNM, Amy Patel. And so pictured here on the upper right is Dr. Sarah in a studio. We recorded a session for their series called Speak for Health, and we basically did an hour of basic health advice for office workers. So some stretches, exercises you can do at your desk, nutrition, how to stay healthy, what happens when everyone around you starts coughing, how do you stay well, sleep, managing your stress. And it went really well. So we started this relationship with Aruga Seva. We finally got to visit them after 5 years of talking about it with Dr. Daya. And so we're looking to do some volunteer exchanges with them in the future. And so I think also the future is just our volunteers and our students. And it's fascinating to see how the profession is developing and how that is helping us do better work abroad as well. So learn all that you can, regardless of what it looks like. We are, 2/3 prospective students here, some current students, others. If you're going to choose naturopathic medicine, again, make sure it's what you want to do on a daily basis. And regardless of where you go, lifelong learning, not as a cliche, but really, I'm constantly studying up on different cases that I'm seeing. I'm seeking outside skills. I'm seeking seminars and conferences as much as I can, time and scheduling permitting. So really focus on that, focus on developing into the doctor, the healthcare provider that you want to be. Get as much experience as you can. In school, you have a safe, supervised learning environment. Take advantage of that. Life is a little bit scarier on the outside when that patient's sitting in front of you and there's no supervisor, there's no resident to go talk to. It's just you. It's a lot more stressful. So try to get as much experience, as much learning as you can during school. Really maximize that time so that you're better prepared when you get out. And I'm all about humor, and I don't mean making light of a very serious, dire situations. Again, we work with all ends of life and death with our global health work. We work with people with terminal illnesses that even the United States would have very little hope for their case. And people who we cannot properly diagnose because we don't have things available, but we know it's not good news. What I mean is that humor really builds bridges. It really can kind of melt down barriers between cultures. It can make light of some situations that are, again, not super dire, but again, kind of build those bridges, melt those barriers. And so pictured at the bottom here. So we take a group picture every time we go to Rocky Point. This is a particularly awesome group. We had a mixed, some SCNM alums helping us supervise. We had Bastyr University of California students, and we had, as always, a lot of SCNM students. No one's shooting this. I had my camera on the ground with a timer. I ran back, 10 seconds. I'm counting down. Just as it shoots, this dog runs across. It was limping. We didn't know if it was a street dog or belonged to the place where we were running our clinic. We do mobile clinics in Rocky Point. But like 2 seconds later, one of the girls said, "Oh man, that's my bread. That dog has my bread," and starts trying to chase the dog. So the dog had, while we were all taking 5 minutes getting ready for our perfect picture there, had stolen her bread and just ran off with it. So that was a memorable part of the trip, and I try to keep things light. I very rarely yell at my students. It's not very effective. I prefer to teach with humor, a light heart. Our work is very serious, so I can't take myself too seriously. And so that's kind of something that has stayed with me. So I wanted to give you all my contact information here. So my email is here. Feel free to send me any questions you may have after we do the little Q&A here. Looks like I'm running about 5 minutes back. Our website, nwb.ngo, not org. And then we have Facebook, Instagram, and Twitter. I would say the Facebook, Instagram are the best way to follow us. And we do have a newsletter as well for more in-depth information. We are looking to do some membership models in the future with our own set of webinars and things, so stay tuned for that. So I am ready for questions, I believe.
Thank you, Dr. Hesler. Would you mind just going one more slide so I can talk about the next events, and then we'll go to...
Yeah, sorry, there we go.
No worries. Okay, so before we start on questions for Dr. Hesler, AANMC has a couple upcoming events next month. So we have a free webinar on naturopathic approaches to type 2 diabetes, which I'm sure, Dr. Hesler, you see abroad quite a bit.
Yes.
And we also have an introduction to naturopathic medicine with me during the Naturopathic Medical College virtual fair on November 13th. So if you want to know a little bit more about some of the basics of what NDs do and some career options, stay tuned for that November 13th webinar. So with that, I'm going to ask you a couple questions. So we have one question which is great. And with the popularity of holistic approaches growing, where do you see the future of naturopathic medicine in 5 to 10 years?
Oh boy. Commenting on the larger profession, you know, there's actually, there's a process that a coalition of the naturopathic organizations are going through right now. They're having some summits, and everybody is kind of giving some input. So we're not just trying to kind of predict the future, but kind of strategically shape it. And so those conversations are ongoing. And 5 to 10 years, gosh, I mean, we are continuing to get states licensed. I'm not, I haven't talked to the licensure people lately, but I'm gonna guess, I don't know, 2 to 6 more states. I have no idea. I don't know where those bills are pending right now. I think you will continue seeing growing public awareness and acceptance. We are every day meeting MDs who are seeing our patients and then wondering what we did that worked so well. You know, I think there's always going to be kind of a skeptical movement, but overall, MDs, DOs, PAs, NPs are kind of leaning our way therapeutically. I think you also see the growth of the larger integrative community, not, as you said, like the holistic modalities, not just naturopaths. MDs are signing up for the Institute for Functional Medicine, their whole series of courses. So I think overall global consciousness is kind of raising to restoring healing traditions from around the world, restoring herbal medicine traditions. So I couldn't give you any specific targets. I think just overall some bigger changes. One person to follow, to look at some of these milestones as they happen, is John Weeks, who publishes prolifically about this very thing, like kind of looking back, lessons to looking forward. So I defer to John Weeks to more properly answer that question. But on a global scale, we are seeing other organizations also kind of following our lead and starting to learn about herbs and teach their patients about herbs as well.
Thank you. And as a follow-up to that, I know that you are always trying to stay on top of technology. Where do you see the role of technology in medicine and medical delivery?
So with Dr. Daya from Arogia Seva, I did, not just, but gosh, that must have been February, March, another episode of their series, Speak for Health. And they have a really nice, a whole series and a whole focus on tech in health. And so we just purchased from them an EKG, 12-lead EKG that is that big and it has some wires coming off of it. And it transmits to my phone, which then uploads to their system, and they have doctors who will interpret it. and get back to us. So um,
That is cool.
a health worker of ours can plug someone in, they can, if they can identify some heart sound, or at least what's not normal, do this. It takes, start to finish, maybe 5 minutes to get them set up and then get an answer. Our health workers are plugged into another organization called the ADDIS Clinic, which is a mobile-based telemedicine, remote telemedicine specialist organization. So they have specialists from around the world who will take questions. They'll answer within 24 hours. So they'll take a case from one of our health workers and send back maybe some more questions about what meds are available, et cetera, and basically tell the health worker what to do from their phone. That's insane to me. So on the more stateside naturopathic side, we're seeing an explosion in genomic medicine. There's some more testing. There's a lot more research coming about with the microbiome and ways that we can modify that. So the sky's the limit. We have robotic surgery now. That's old. So we're looking into nanotech in the future. It'll be interesting to see how these technologies intersect with naturopathic medicine. I am teaching a series on regenerative medicine, pain, musculoskeletal mastery, and we will be covering some of these newer technologies, some of these newer cell-based therapies, and changes in regulation on them as well. So
thank you. Thank you so much. Yeah, that EKG thing. Wow, that's a game changer.
Yes, it's amazing. I've used it a few times so far. We're kind of helping them kind of beta test the software, work out the bugs, but
wow,
the resolution of it is amazing. I'm blown away.
So another question for you, and this is more focused on the U.S., but I know a lot of your work is with underserved communities, and I know one of the things often levied at naturopathic medicine is that these natural therapies are often seen as a luxury and maybe not as accessible. And so, can you speak to increasing access for marginalized communities here within the U.S. for naturopathic medicine?
Yes. So a number of ways to do that. So for one, you are deciding what you want to charge, what the market will support, what your patients will support, your value. There's larger conversations that we're having in terms of how do we provide the best care to different populations, in terms of practicing cost effectively. Aside from cutting down your quality, doing really brief visits, high volume, you can focus on, with all of our tools, again, using therapies that have a low supply cost so that it's your labor cost and you can determine what that is for your patients. So there are very fancy injection therapies that cost a lot of money that do amazing things. I don't want to denigrate these. Lasers, all kinds of amazing things. Our root cause foundational naturopathic medicine works. It has for a very long time, and much of it doesn't require those things. And the more that we do the groundwork, the less that we need fancy therapies. One thing that I will say, just to kind of add on to that's not a very unique perspective, to add on to that is group medical visits. So I have presented the last 4 years at a conference called Integrative Medicine for the Underserved. It is a fantastic organization. If you are at all interested, again, even if a prospective student, you haven't started ND school or you're opting for something else, go to that conference. And they have a lot of resources on the website as well. It is a coalition of integrative practitioners who are serving the underserved in different ways and sharing those lessons. So I usually do like some kind of pain-focused, hands-on thing to give practitioners those tools. I learn more systems and more like stress relief techniques when I go. But the biggest thing I've learned is group medical visits. So imagine, instead of the one-on-one visits, kind of doing what our health workers do in Haiti, where you have a group of up to 12, 20 people They might be united by a condition or a service. They might not. They might be a heterogeneous population, all supporting each other, all learning, all asking you instead of you lecturing at them. But it's a chance for you to get across the things that we say over and over again. So we do individualized diet and exercise and stretches and all that. But the further out you get, the more that there's just certain things that you're going to say over and over, right? We're not going to encourage people to eat junk food, generally like excessive fried animal products, for instance. So there's some things that would be better done in a group. But at the same time, while that's happening, you can pull people apart one by one and do a brief 5 to 10 minute medical visit. Follow up on, have you made the changes? How are you doing? Take your blood pressure, whatever we're monitoring, put them back in the group. Depending on the state you're in, you may or may not be able to actually bill state Medicaid for that. And so you can actually make more per hour doing that and serve people with quality care. So they get a whole hour or 2 hour group visit where they're learning all these things. Maybe it's a cooking class, maybe it's an exercise class, whatever you're doing, and you do a brief medical visit on the side. So it's just a different practice model that is one way to bring what we do. And more, again, integrative clinics are using this model because patient outcomes are actually better. Patient satisfaction is much better. They get to try new things, and it treats loneliness, which is in the geriatric population, number one predictor of death within 5 years is how lonely they are. So all those things together.
Thank you. A couple questions have come in regarding potential students or people interested in volunteering with your organization. So I'll just kind of lump them together. One, can anybody apply to be a volunteer, or is it just US residents? And as a student, if they plan to work with NWB, are there any modalities specifically that help them prepare for this? And how do you block off time for international work?
Great. So yes, anyone can volunteer. Not just Americans, not just Canadians, not just current students, not just NDs. We had this discussion about even just continuing to highlight naturopathic medicine within our mission and vision. Is that immediately there's a whole set of, say, RPA students who are like, oh, so I don't think I can come. And they'll ask us, can I come? Yes, we want all of your help. To your skill level, to the extent that we can supervise you or that you can operate on your own, depending on what type of volunteer you are. Yes, we need all the help that we can get. What was the next? Can anyone volunteer? Modalities to focus on. Definitely physical medicine is good. Now, this is not to say that if you're not good at it, don't come. You will be getting experience. We will be teaching you in the evenings, whether it's Haiti or Mexico or Thailand. We do what we call phys med parties. So we're, again, supervised fashion, practicing on each other, learning some new techniques. We do quite a bit of acupuncture. In Thailand, we do a lot of IV therapy. So that's an opportunity to get IV experience. And yeah, you need to know medications because patients are on medications. Whether or not we're using them, we need to know if the patients are affected by their side effects, if they're clashing with each other, if they're even just appropriate prescriptions to begin with, regardless of what's going on. Can we stop it? Can we taper it? Do they need to stay on it to stay alive? Do we add natural therapeutics and then discontinue it? Or so you need to have, and again, we will be discussing common medications, et cetera, but having a background and knowing what medications are is helpful. But again, we have first year students who are helping with the medicinary, who are helping run the clinic. They're hearing the case presentations, even though they may not be, directly as involved. They can help take vitals. So I'm not implying that you need to already have a complete skill set to come volunteer. Absolutely not. But those are the things that I would focus on. I can't remember the third question.
So There's another question that came in, and I'm going to do my best to get to all of them. Um, so practicing ND, approaching their 10th year of practice, currently working with a not very diverse population in an affluent area. Um, how how do you start working with NWB and or um, also diversifying the population that I hear from folks. I just spoke with a doctor this week in Greater Illinois area who has opened up a nonprofit so that she could create more access for the patient population that really does need what we have to offer. So do you have any guidance for existing NDs out there in the field, or people even considering wanting to have more of a community-based practice?
Sure. So that reminds me of the third question, which I forgot, which is kind of blocking off time. So for the student side, we are typically, in Haiti, we're open year round. We're currently not accepting volunteers for Haiti, but we have Dr. Sarah Polanco there, who was my second year community medicine resident at SCNM, and who is actually now a co-chair of our organization on the board. She lives in Haiti right now. She has for the last year, and she works with the Haitian health workers. So we typically will accept volunteers on a kind of a rolling basis. Otherwise, for Rocky Point, it's weekends. 3 times a year we do the 3-day weekends, so that's a little more amenable for flying in versus driving. And we're typically opening up volunteer weeks when students have breaks. So blocking that off as a professional to come volunteer really depends. We understand, we sympathize that if most of us are our own bosses, and so that's potentially, rescheduling like a week of lost revenue, and I don't have a great answer for that other than locums. But how to kind of see different patients within your own clinic. So one way that some docs are doing it is kind of creating a nonprofit separate organization using the same space within your space, and inviting people to come in who can't afford your care. You could volunteer in your community, even if you don't know of an ND clinic, adding on to what's already happening. There are NDs that go and volunteer at St. Vincent de Paul in Phoenix. And just like how you might kind of mold your way into an MD clinic as they see that, oh yeah, actually this ND knows what they're doing and they can help our patients. Yeah, let's have them start seeing patients. Many of our connections have organically operated that way, where a group has heard about us, or we've just kind of shown up and they're like, oh, you can do acupuncture? We'd love to send you acupuncture patients. Oh, you could do this? And just kind of build your way into it. As far as kind of diversifying your own private practice, it's going to depend on your flexibility with pricing, and you might consider that group visit model that I just discussed, because it's totally different from one-on-one model. Jeff Geller is, in my mind, at the forefront of developing this group medical visit model, and he has, I'm sorry, I can't remember the name of it. If you look up Jeff Geller, MD, he's doing a whole series of courses. He has a whole clinic focused in Massachusetts on doing group visits and teaching how to do group visits. So that integrative medicine group visits. So that's, again, an easy answer that I have is to start doing those. Start getting some of your patients into those groups. And then that's one way to provide more low-cost care to underserved populations.
Thank you. So another question just in regards to ongoing research with, various different types. I know that we're often asked, where's the research for this? And, just this morning I was reading a study about hydrotherapy in geriatric patients for sleep. And so, I think there are, and I'll let you chime in a second, but I think there's a lot of misperceptions and misunderstandings about the perceived lack of research. Now, there are areas where research is developing, but there are also areas that have been well documented and well studied that maybe people just don't realize that has occurred. So I don't know if you want to speak to research a little bit.
Yes, I think it's kind of evidence-informed practice, evidence-based medicine, I think is very misunderstood. It's using the best evidence that we have available, and some of that involves getting off your butt and doing a literature search, instead of just saying by default, like la la la, there's no data. There's more than you would think, and not all of it is huge, well-funded trials. We have to do the best with what we have, and generally not having patents for the products that we're using, for the herbs that we're using, and the economics of that. That said, look for it. There's more than you would think. And it's ongoing. I can't speak for the other colleges. I do have some familiarity with SANM's research department. They're focusing on infectious disease. They're doing some really solid genomics and in vitro, some bench science on botanicals, with different cytokines, with different, MRSA, HPV, other viruses as well. That is really translating well clinically as well. So there's a variety of human and basic science research that's happening within the profession, and that NDs are collaborating on outside of the profession as well.
Thank you. And each of the AANMC member schools operates research departments. There are research requirements for graduation. So that is something that we are constantly looking at, building the body of literature, whether it's case reporting or well-funded studies, like you said. One question that came in, and I'm kind of toying with how to phrase this. So, we hear from students who maybe they have family members that may not be familiar with naturopathic medicine, or you want to be a natural what, or why would you do that? Why not go be a real doctor? And I think that, especially with, younger students who may not have, as much life experience under their belt to stand up for themselves necessarily. What is your advice for folks? And I'll caveat this because I graduated in 2000, and I definitely got that from some family members myself. But I will say that the tide is turning, and has turned very much. And I think that there is a perception that there's probably more backlash against us than there really is in reality. I have found very, very open physicians, medical doctors, osteopaths, nurse practitioners, midwives, etc., who actually want to learn more about what we do. And once they find out about the education and the training, they're actually very, very positive and enthusiastic supporters for us. So, and including legislators as well. So I just want to counter that there's, a huge body of people out there pointing their fingers and shaking their noses at us. There are always going to be naysayers. Like you said earlier, Dr. Hesler, there are always skeptics. I have friends who are lawyers where people are on them for, why do you want to be a lawyer and be part of the bad guys? Like, I have my best friend who is a dentist, and people, turned down their nose at him because he became a dentist. So, I think at the end of the day, it's amazing. Yeah. It really is amazing.
Yeah,
at the end of the day, you have to follow your heart and your passion. And there's always going to be someone out there trying to bring you down, and it's up to you not to let them.
Yeah, I mean, I would, I think there's a variety of cultural family dynamics that, hard to speak kind of cross-culturally on that, because it really depends on your situation. And, I think there is the group of haters who are going to hate. There's a lot of supporters. There's a lot of people who are curious in between. And so, like how my family was initially skeptical. My dad had a bad experience with a chiropractor earlier in his life. That most people have great times with their chiropractors and are really won over by the therapy. And so, but at the same time, safety is key, and one bad experience could really color your whole perception of things. And so it took our PA to refer me to the chiro, like that kind of, that rapport, that social proofing, Kara was I'm musculoskeletal, I'm a mixer, I'm only going to do what I know. I'm going to refer if anything's a red flag, and here we go. And I've seen hundreds of cases like yours, and we've got a good shot at getting it better, and didn't make any big promises. And boom, here I am. So it really depends. To me, I was just, we just had this first class, if I can wax with a quick story. And so I was teaching with Dr. Jose Molina. This is his first real teaching experience, with the seminar. And he was, talking about just some different pearls that I picked up from doing the group visit classes, from just, educating students, educating doctors, educating community members. And I said, pick the person in the room who's not that excited about what you're talking about and engage them. Find out why. Use motivational interviewing techniques, whatever it is, but find out what their hang up is, because instead of just assuming they're automatically a hater, see if they have a misunderstanding. Maybe they're just, they've heard some, without a better term, like snake oil salesmen make all kinds of grand claims. So I have a lot of skepticism for people with a lot of multi-level marketing programs, really over marketing things that I've looked into, that I've read, and they're really overstating their claims. And likewise, someone could be looking at us and putting us in that manner when we say, oh, we do all these therapies, we get our patients better. And they're like, okay, really? I enjoy that level of skepticism, because it's someone who will hopefully look into it and then ultimately see the facts, see the truth. So I like to actually engage them and find out what is their hang up, and am I coming off too strong? What is it that I can do to really explain what's going on? And you can't change all the minds, especially in today's political environment where things are so polarized and people tend to dig into their tribal leanings. That really happens in all areas of life. And so to me, everyone is, potential person to explain to. And absolutely, some people are just going to try to tear you down. Don't give them any energy, don't give them oxygen. But I think the vast majority of people, like you said, are not really dead set haters. So talk to them.
I think that is wonderful advice. And I know that we are just about out of time here. For those who have questions that have not been answered, or something comes to you after the fact, please email info@aanmc.org. That's info@aanmc.org. And we're happy to get your questions answered. I see a question that came in regarding careers. I'm going to be talking about that quite a bit on the webinar on November 13th, Hyatt. So if you'd like to join then, or email us, we can definitely chat with you about that. We also have resources on our website. So thanks again, Dr. Hesler. I appreciate your time. Thank you for your passion for global health. Thank you for all you do for the world community. And from the bottom of my heart, thank you for being with us today.